The first topic is eating disorders. There are two types of eating disorders that we'll talk about. The first is anorexia nervosa, and the second is bulimia nervosa. With anorexia, you have less than 85% of body weight. There's an intense fear of becoming fat, a distorted body image, and amenorrhea. With anorexia nervosa, the MNT is 100% DRI and RDA, 113% kilocal, and then increasing 100 to 200 calories every 3 days. There should be balanced macronutrients and insoluble fiber to help alleviate constipation. Bulimia nervosa is binge eating and inappropriate compensation to lose weight, such as laxatives, excessive exercising, and vomiting. The MNT for bulimia nervosa is calories to maintain weight, to balance macronutrients, 100% DRI and RDA, and avoid weight reduction diets. The next we'll talk about food allergies and intolerances. Food allergies are adverse food reactions and involve the immune system and an antibody-antigen response. In children, the most common are eggs, fish, milk, peanuts, and soy, and in adults, the most common are fish, tree nuts, peanuts, shellfish, and wheat. This is an allergy to protein, and the MNT for food allergy is to avoid complete avoidance of the food. As opposed to food intolerance, which is non-immunologic, there is an example of this is lactose intolerance, which in the person there is no lactase. There's a lactase deficiency, which converts lactose to glucose and galactose. There are two ways to detect this intolerance. You can do a breath hydrogen test or a lactose tolerance test. Lactose intolerance is from heredity or from Crohn's, celiac, or an intestinal infection, which would be a secondary. And the symptoms are abdominal cramping, bloating, and diarrhea. The MNT is to avoid lactose products such as milk and yogurt, or purchase milk with a lactase enzyme, and solid milk products are usually okay, such as cheese. Oncology nutrition. There are carcinogen inhibitors and carcinogen enhancers. The inhibitors are dietary fiber, antioxidants such as vitamin C, E, selenium, carotenoids, phytochemicals such as anthocyanins, which are water soluble, they're blue, red, or purple, and anthoxidants, which are clear, white, or yellow, lycopene, indoles, which is broccoli, cabbage, Brussels sprouts, and it comes from the destruction of the plant cells, or sulforaphanes. Carcinogen enhancers are fat and red meat, polycyclic aromatic hydrocarbons, which come from grilling meat, aflatoxins, and safrole. Oncology MNT, for calories you take the Harris-Benedict equation plus the stress factor. The Harris-Benedict equation for males is 66 plus 3.7 times weight in kilograms plus 5 times height in centimeters minus 6.76 times age in years. For females, it is 655 plus 9.6 times weight in kilograms plus 1.8 times height in centimeters minus 4.7 times age in years. The protein is 1 to 2 grams per kilogram depending on if the patient is stressed or not. If the patient has sepsis or is stressed, the protein will increase. There should be neutropenic, you should avoid foods with bacteria due to translocation, which means that the bacteria can leave the gut and go to different areas of the body. Examples of neutropenic diets are to avoid raw foods and to cook foods thoroughly. American Cancer Society suggests to increase plant foods, have 5 servings of fruit and vegetables daily, increase whole grains, decrease red meat, maintain a healthy weight, have physical activity, and limit alcohol. HIV/AIDS. HIV can progress to AIDS. The CD4 cells protects against infection, but when you have HIV, there's a decrease in CD4 cells, which can lead to immunodeficiency. In HIV, you'll often see protein-calorie malnutrition and AIDS wasting syndrome, which is a decrease in greater than 10% of body weight plus diarrhea, weakness, and fever. Also in HIV, there are many opportunist infections because of immunodeficiency. HIV complications. There is diarrhea, which can have malabsorption, and the treatment is a low-fat diet plus MCT oil. There are problems with the oral cavity, such as oral lesions, and to treat it, you use soft, moist foods, no spicy or acidic or hot or cold foods. There are neurologic complications, such as psychomotor impairment and severe dementia. And to treat it, there's an increased risk of aspiration, so to treat it, you would need dysphagia diabetes. HIV MNT. Calories intake BEE times 1.3 for maintenance and BEE times 1.5 for repletion. You should supplement zinc, selenium, B6, B12, A, and C, especially if there is diarrhea. The protein is 1 to 1.4 grams per kilogram for maintenance, 1.5 to 2 grams per kilogram for repletion. And there should be a low-fat diet for diarrhea or malabsorption. Malnutrition, PEM or PCM. There are two types of protein calorie or protein energy malnutrition. There's marasmus and kwashiorkor. With marasmus, there is no calories or protein. There's wasting of somatic fat and muscle. There's preservation of visceral protein. There's no edema. There's severe muscle fat wasting. There's severe stunted growth. There's an enlarged liver, mild potassium depletion, and serum albumin is only slightly low. With kwashiorkor, the calories are okay, but there's not enough protein intake. The visceral protein is wasted, but somatic is preserved. There is edema, there's little muscle fat wasting. There's dyspigmentation of the skin, moderate growth stunting, an enlarged liver, severe potassium depletion, very low visceral protein, albumin is severely low, and there is increased extracellular water, which makes edema. Question 1. Which protein calorie malnutrition or malnutrition is present when there is edema, enlarged liver, severe potassium depletion, and severely depleted albumin? The answer is kwashiorkor. Question 2. An inhibitor of carcinogens is the phytochemical anthocyanins. What color or colors are they? They are red, blue, and purple. Question 3. Which patient requires more protein, a non-stressed cancer patient or an AIDS wasting patient? The answer is an AIDS wasting patient requires 1.5 to 2 grams per kilogram, while a non-stressed cancer patient requires 1 to 1.2 grams per kilogram.